Autism spectrum disorder, ASD or autism, is a neurological disorder of unknown cause. The Center for Disease Control and Prevention documents the bewildering prevalence of ASD in the United States. Medical professionals don't really understand what causes autism. Some professionals have associated the causes of autism with genetic mutations, vaccines, excessive brain size, or an overactive set of neurons in the brain. There is no professional consensus or definitive evidence on what causes autism. However, what we do know are the effects autism has on learning and behavior. We do know two things. Autism is not caused by differences in parenting. It is a biological condition, and we do have science-based treatments that are effective. Autism is defined by behavioral delays in the development of social language, functional communication, and age-appropriate independent behaviors. Children affected by autism spectrum disorders appear delayed in developing language skills, social interaction skills, and establishing and maintaining eye contact when engaged by family members. These children may also exhibit stereotyped behavior, often called or described as behavioral excesses, such as spinning, jumping, hand flapping, and other repetitive movements of the body. Perhaps the most important thing to understand about children affected by ASD is they require specialized instructional practices in order to make effective progress. Although professionals are uncertain of the exact causes of ASD, there are clear roadmaps that allow us to develop treatment procedures that result in the best outcomes for these children. Research shows that early treatment can greatly improve a child's development. Early intervention services help children learn important skills. Services can include therapy to help young children learn to talk, walk, and interact with others. Therefore, it is important to speak to the child's doctor as soon as possible if you think the child has ASD or another developmental problem. To put it simply, intervention should start as early as possible. When parents begin to notice a child is not meeting expected developmental milestones, a common response is they'll grow out of it. Unfortunately, the longer you wait, the more difficulty you and your child may have. If you are concerned about a child's development, whether it's their communication, social skills, or behaviors, you should begin seeking information and assistance as soon as you can. While we are still learning many things about autism, we know there are critical elements to achieve the best outcome from treatment. Treatment should begin as early in a child's development as possible. Second, treatment should be intensive. Finally, treatment must be implemented and supervised by professionals specifically trained in applied behavior analysis. It is important to note that effective treatment cannot be achieved by adding a single consultant to an existing treatment team. Effective treatment requires a commitment to comprehensive service philosophy centered in applied behavior analysis, ABA. Treatment supervisors should be certified or licensed behavior analysts. Staff should receive ongoing training in ABA, and treatment should be guided by a formal curriculum and child progress. It is very easy to refer to services as behavioral in nature, but in practice, effective treatment requires a comprehensive commitment to highly specialized staff and supervision resources. When these factors are integrated into a comprehensive autism treatment program, it increases the likelihood the child will learn to communicate, engage in social interactions, and develop adaptive rather than problem behavior. Research shows that children who receive behavioral intervention early and intensively are more likely to have improved long-term outcomes. These services can maximize learning potential by addressing communication, play skills, problem behaviors, and overall development from a very early age. We know through research that the brain's plasticity, the brain's ability to change and learn new skills, decreases with age. When children are very young, their capacity to develop is greatest. When this plasticity decreases, it becomes more difficult to learn new skills and change ingrained patterns of behavior. This is not to say that individuals with autism are not able to learn new skills if intervention is not started by a certain age. The brain of an individual with autism is much like everyone else's, capable of learning and using new skills and information at any time. Behaviorally speaking, however, as we all age and grow, the skills we have learned, both good and bad, will be more difficult to change. So the earlier we intervene to address an individual's difficulties with communication and social interactions, the better. One of the most important things parents can do for a child impacted by ASD is to find a treatment that is based in science. The treatment approach with the most scientific backing is applied behavior analysis, or ABA. Behavior analysis is a natural science of behavior that was originally described by a Harvard researcher, B.F. Skinner, in the 1930s. The principles and methods of behavior analysis have been applied effectively in many arenas. One of the key principles is known as positive reinforcement. A positive reinforcement instructional procedure occurs when a desired behavior is exhibited by the child is provided something they value, and as a result, the behavior is more likely to occur in the future. The ABA therapist will work with the parent to identify specific age-appropriate behaviors needed for development. These behavioral targets may be learning how to request preferred items, playing with others, using words to replace tantrums, or following an instruction. A series of carefully designed instructional interactions between the child and the therapist using the principles of positive reinforcement are used in the home to teach essential skills needed to start school, interact with family members, and promote age-appropriate independence. Since the early 1960s and 70s, behavior analysts have used positive reinforcement and other behavioral principles to build communication, play, and social skills to reduce problem behaviors in learners affected by autism of all ages. Some techniques involve instruction that is directed by adults in a highly structured fashion, while others make use of the learner's natural interests and follow his or her actions. Still others teach skills during routine daily activities while at school or play. All skills are broken down into small steps or components, and learners are provided many repeated opportunities to learn and practice skills in a variety of settings with an abundance of praise and rewards. The goals of intervention, as well as the specific types of instructions, are customized to the strengths and needs of the individual learner. Performance is measured continuously by direct observation, and treatment is modified if the data shows that the learner is not making satisfactory progress. Regardless of the age of the learner affected by autism, the goal of ABA intervention is to enable the child to function as independently and successfully as possible in a variety of environments. Getting high-quality ABA services is important. However, much like a medication, it is equally important to receive the correct amount or dosage of weekly service hours. Unlike other learning challenges, a specific treatment approach is required to effectively develop the skills for children affected by ASD. Research suggests that children should receive 25 to 40 hours of intensive early intervention per week. However, treatment may occur in the home during typical family routines, playtime, family visits to the grocery store, or community outings. While this may seem like an extraordinary amount of time for a child, intensity of intervention has been shown to be a key element in addressing the needs of children affected by autism. Remember, a typical 5-year-old child without any challenges is in school for 30 or more hours each week, and still younger children engage in learning interactions with their parents throughout the day. Treatment hours may be provided by ABA therapists, a speech therapist, parents, or other family members who have been trained in the technique. In an ideal situation, intervention procedures should be implemented throughout the day, across settings and across people with whom the child interacts. This intensity and consistency of intervention can help propel a child towards success. Isn't that what we all want? However, not all children affected by ASD require 25 to 40 hours per week. Service intensity, the number of weekly treatment hours, is not a one-size-fits-all proposition. Instead, service intensity should be determined by how well the child responds to intervention. Children who have difficulties meeting their goals and objectives should receive the highest amount of weekly treatment hours or intensity. Children who respond very well to treatment by meeting their treatment goals and objectives may require fewer hours of weekly treatment. However, what is clear is that decisions regarding treatment intensity should be determined based on the child's actual progress rather than what is done with typically developing children of the same age. It is also clear from the scientific literature that children impacted by ASD should receive more than 10 hours of weekly intervention per week in order to have the best chance of making measurable treatment gains. Applied behavior analysts should supervise the correct implementation of the treatment program grounded in evidence-based practice. When done well, these procedures are customized to the needs of the child and family. Treatment should be informed by input from other professionals, such as speech therapists. However, it's important that practitioners within the team coordinate treatment approaches in order to benefit fully from carefully considered behavioral treatment. There is a considerable history of research on early intensive behavioral intervention. Research has been done on specific applications of behavioral principles, training communication skills, social skills, and their prerequisites. Long-term studies have demonstrated the effectiveness of early intensive behavioral intervention for children affected by autism. ABA-based intervention has been endorsed by the American Academy of Pediatrics, National Institute for Health, Center for Disease Control, as well as many state government panels that have evaluated research on treatments with children affected by autism. In many states, ABA-based treatment for autism is recognized and funded by health insurance providers. When done well, ABA-based services are highly individualized and are woven into the family's daily routines. It is critical that treatment involve parents and all family members as part of the intervention. It's important to realize that ABA treatment is not 30 to 40 hours in a room with a single person doing the same activity over and over again. Such an approach is inconsistent with the breadth and depth of challenges and skills these children need to fully participate in the community. Typically, ABA treatment hours include all hours spent in one-on-one instruction with the child, small group instruction, parent instruction, and planned learning sessions in the natural environment when the therapist is not present. Instruction can take place in a variety of settings. It can take place with the parents at home and in the community. It can take place during daily playtime routines, such as mealtime, getting dressed, using the bathroom, cleaning the house, practicing household chores and activities that they may not pick up otherwise. Instruction can take place while playing with other children or siblings. Done correctly, ABA provides a child with a rich and exciting experience that incorporates all parts of family life. It can be the key to unlocking a rich life of education, play, and caring social relationships. There is a wealth of information out there on what constitutes good treatment practices for children diagnosed with autism. But the question that's most important to answer for parents who are dealing with this reality is, what do I do next? It is recommended that parents interview all behavioral providers to find the best match for the child and family. Parents should inquire about the behavior analyst's formal training, certification or licensing status, experience providing home-based services, supervision and training of non-credentialed staff, data collection methods, formal curriculum to be used, and expectations for communicating with parents. Parents should ask the behavior analyst what an ABA session looks like and how the skills taught during sessions will be transferred to the family's everyday routines. Families should ask about frequency of supervision by credentialed supervisors. They should also ask if staff are engaged in ongoing continuing education in behavior analysis. Just as important is the support provided to families and the participation of those families in treatment. Parents and other family members are the most important part of a child's learning environment. An ABA approach recognizes this and actively involves parents in treatment. To promote maximum effectiveness and progress, parents should learn the techniques used by the ABA therapist. Parents can expect to learn how to make their attention available for good behavior and how to respond to problem behavior. A major focus of parent involvement concerns teaching parents to apply skills acquired in treatment across a wider range of settings and people. Often, skills are taught initially by a trained therapist and then expanded to occur in more typical environments, and with the people the child is most likely to find in those environments. Highly motivated, highly involved parents are the most important resource a child affected by autism can have. The message we hope you take away from this informational video is that our ability to help children with autism to live a more independent life has never been greater. ABA-based treatment and, more specifically, early intensive behavioral intervention has a larger body of scientific literature documenting its effectiveness than any other treatment. We know more about what works than ever before, and more children are getting the services they need. If a child receives an early diagnosis of autism and accesses intensive behavioral intervention as early as possible, the likelihood is they will achieve more than if they received any other treatment. This is a time for great optimism in the treatment of autism because we have treatment options that are effective, and the prognosis for those who receive the correct intensity of services as early as possible is often quite positive. Today, more children diagnosed with autism are functioning effectively in their social, language, recreational, and academic lives than ever before.